We have two Pleur-evac chest drainage systems here in this hospital. One is the Mini Sahara that is only has a capability of up to 500 mLs of fluid collection. It's much smaller. You'll see patients who are able to ambulate will sometimes have this, or younger patients. And then over here we have the one that's probably more common for you to see on the floor, and that's the Pleur-evac A6000, otherwise known as the Cactus. Okay, that's got a capacity of 2,500 cc's to collect fluid. I'm going to point out a couple of different parts of this chest tube drainage system so you can see what each thing is and what it does. Okay, so first of all, to set up this system, it's pretty simple. You're actually going to go here. Now they're not all conveniently labeled like I have labeled them for you, but you're going to actually fill the water that comes with the chest tube drainage system into this port here. It says fill water. This is also going to be the chamber that you attach the suction tubing to, okay? This is a negative pressure valve. You can actually press it to reduce negative pressure if it builds up in the system. This is a positive pressure valve. You don't want to occlude that because that is able to, if it's open, it's able to help regulate the pressure within the system. And I'm gonna look here and just do some basic anatomy. This is your suction control right here, okay? So if the order is for 20, great, it's preset. If not, if you wanna go higher, you can go this way, or if you wanna go lower, you go the other way. Okay, so this is your water seal chamber here. This is where you're going to see the presence of an air leak. Once you put the water into the water seal chamber, it will turn blue, okay? It isn't blue when it goes in, but once it gets in there, it is going to turn blue, and you will see it's filled to this 2 centimeter mark. And the water chamber is going to bubble when you have an air leak, and you're gonna see that bubbling on inspiration and expiration. You're also going to see something called tidling, and that is when this fluid column here rises and falls with the patient's breathing, okay? And I'm gonna demonstrate that for you as well. So when the patient has an air leak, you're going to see bubbles in this chamber. Hopefully the bubbles lessen over time. One day you might have air leak where the bubbles actually go to say 6 or 7. That's pretty big air leak. And then maybe over time, in the next couple of days, it slowly goes down to the point where maybe it's at a 2. And then hopefully eventually you won't see any bubbles at all. Not seeing any bubbles at all is a good thing. That means the air leak has hopefully sealed, and perhaps it might be time to consider taking that chest tube out. So I'm going to show you now what the bubbling looks like and the tidling looks like. So as you can see, when the patient breathes out, all that air that's still leaking is going to go into the chamber here, into the air leak meter. And the patient's breathing in and out will cause the water column here to rise and fall. That's normal, it's okay. If you see that, it's a normal finding. Now let's talk a little bit about setting up the chest tube. It comes in a very large package, and what you're going to find is a chest tube drainage system, and in the back of the chest tube drainage system is going to be this little container that's going to be full of sterile water. This is the sterile water that you put into the water seal chamber, right? It's already pre-measured, good to go. You open it up, you plop it right in here, and you squeeze, 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 squeeze. And then you'll see the water actually running down here all the way into the chamber, okay? So once you've emptied this little bottle here, you should have a air leak meter and water seal chamber that looks just like this.